Welcome, everybody. Welcome to Spine Time. My name is Roger Härtl. I'm your host today. I'm the neurosurgical director of spine surgery at Weill Cornell, Ox Spine in New York City. I'm also one of the co-directors of the Center for Comprehensive Spine Care in New York. Thanks for calling in tonight, and we've got a great topic, one of my favorite topics, wine and spine. From indulging to channel surfing, how your daily habits affect your back. I hope you all have a lot of questions. We'll try to cover those. And as always, we are at the Spine Center on the Upper East Side in New York City. Many of you have visited us. We're combining not only surgical spine care, but we also have neurology here, spine neurology, pain management, sports medicine, physiatry, and we're trying to work together to come up with a good diagnosis treatment plan to help you through the recovery if you need spine surgery. Most of you won't, but we'll try to make this a comprehensive and satisfying experience for you, of course. And part of this is really patient education, and part of it is really the ability to find time to talk about topics that are relevant, and things like recreational activities, wine and other activities that we do outside medicine are certainly important because they can affect the way that we treat our body and the way that we can heal from anything that affects us. We have a great panel of experts here, some of the co-directors of the Center for Comprehensive Spine Care, Dr. Singh, who is the Director of Interventional Spine and Rehabilitation Medicine at Weill Cornell, and Dr. Josh Weaver, who is the neurologist who joined us a number of years ago now here at the Center for Comprehensive Spine Care, and who is really an expert when it comes to anything spine related and neurology. But he also has an interest a big interest in complementary and alternative medicine. So it's great to have you guys here. Wine and Spine, thanks for being here. We'll get started. We've been going through a very, very difficult time over the last year, almost year and a half. Some of us have had their share of quarantines, and that's a good starting point. The question is, and we talked about this before, sitting on the desk all day, not being able to really do a lot of sports, go outside, affects our health, our spine health. But what about alcohol? What about things that maybe habits that we've taken up over the last year and a half that may not be that healthy? And does that actually affect the way that we suffer from back pain and neck problems? And I want to ask Josh Weaver, who is here tonight. Again, thank you for being here. What is a drink, Josh, and alcohol? How does it affect us in terms of our back spine health?
Thank you for that intro, Roger. So I think we're all kind of laughing a little bit here because we all really love wine, and so wine and spine was just like a really fun topic for all of us. It's interesting because there's a lot of research on alcohol and its effects on people's health. In particular, there is some link to spine health as well, but the research is a little unclear. It's a little confusing. So one thing I just wanted to get out of the way, off the bat was when we talk about a drink, right? What are we talking about? And really, what we're talking about here, it's sort of in that picture. It would be one 12-ounce can of beer. It would be a 5-ounce pour of wine, not like a full glass of wine. It would be one shot of a hard liquor. So that's really what we're talking about when we talk about a drink, which is important because when we talk about, how many drinks is too much, how many drinks is it okay to have, that's when we do those studies and we look at the guidelines. This is what they're talking about. A lot of people think, I only had 2 drinks, but if your 2 drinks were really, really big glasses of wine, that might actually be 4 drinks that you had, and I think during the pandemic, we might all have been a little guilty of doing that a bit more than we should have. We can go to the next slide. So, what are the recommendations, right? So first of all, a lot of conflicted research going on. And I sorry, this is a little bit of a wordy slide here, but I just wanted to make sure we hit on this. There are a lot of studies, particularly about red wine, but a lot of them have shown alcohol in general may have some ability to reduce inflammation at mild to moderate levels. Certainly at heavy use of alcohol, it can be very pro-inflammatory and it can have a lot of deleterious effects on the body. But there is some suggestion that at other parts of the body, may be affected in a healthy way. The jury's out on that though. So there's some suggestion that it can reduce your risk of heart disease, reduce your risk of stroke or diabetes. There are some animal studies that have shown, particularly about the spine, that it might, the chemical that's in red wine, the flavonoid, the resveratrol, may actually reduce disc degeneration in the spine. So, kind of unclear. But it's also kind of clear that even light drinkers, people who don't drink more than one drink a day, have a small, slightly increased risk of certain cancers. And definitely, I think it's very clear, chronic, moderate, or heavy use is definitely linked to increased risk of mortality and also cancer, as well as heart disease, stroke, a whole lot of other things. So I think that's clear. When we talk about guidelines, the CDC came out with a guideline a few years back that said, 1 drink for women and 2 drinks for men per day would be an acceptable and reasonable thing to do. There were even some guidelines that came out that said we should be doing that from a heart health perspective, because there was some data to suggest that that was helpful. Lately, that's come into question a little bit, and there have been more research that has said that maybe actually no alcohol is best. The American Cancer Society actually came out with guidelines that said really it's best to just not drink alcohol. However, they have a caveat there because I think it's a little unrealistic. A lot of people out there do drink. And so they said, if you do choose to drink alcohol, it's what we just talked about, 1 drink for women, 2 drinks for men. The CDC, as of, I think, less than a year ago, they updated their guidelines and really said that men and women should be equal at 1 alcoholic beverage per day and no more than that. So these guidelines keep fluctuating, and it's not really clear. I think what is clear is heavy drinking or even moderate drinking is probably too much. And really, probably more importantly is having a healthy diet and being physically active is going to have a much greater impact on your health than any small amount of alcohol. We can move on to the next slide.
Josh, I mean, before you're clearly an expert on this topic, as I'm finding out right now, which is great. But just a few words, and these guidelines take into consideration not only back or neck issues, but obviously other important factors, cancer risk, heart disease, and so forth. But maybe before we go further, how would alcohol affect our back or our neck? You talked about inflammation, for example. I'm just wondering if we can talk about that. What's the link between alcohol and back and neck issues potentially?
Well, yeah, so there probably is not so much of a direct link as there is to heart disease or even just nerve health in general. I mean, we do know that alcohol is a nerve toxin, but small amounts of alcohol can be cleared relatively well by the body. And the thought is there might be, particularly in red wine, there might be some anti-inflammatory properties. There are these chemicals that are found in fruits and vegetables, including grapes, that are called flavonoids, as well as polyphenols, which are particularly in red wine. And those actually do have anti-inflammatory properties that may actually interact with the gut microbiome, as well as reducing inflammatory markers in our body or inflammatory chemicals in our body. There's these antioxidant properties to some of these chemicals, and so they help actually make things a little healthier. That's the thought. So in terms of spine health alone, anything that will help reduce inflammation theoretically can help reduce wear and tear damage that we might feel in the neck or the back. So that's the idea there. Alcohol also can be considered partly a muscle relaxant. It can help reduce pain levels as well. But that is a very risky thing because a lot of people will drink to reduce their pain. And then you start developing a tolerance to that and you start drinking more and more because it sort of hides or masks the pain.
Right, Josh, I was gonna agree with you on that. You know, if you look at alcohol and, you know, one of the ways we treat withdrawal from alcohol is with a medication called a benzodiazepine, right? Valium, Xanax, they're kind of in the same family as alcohol. So a lot of people, a lot of patients, you know, say, I'm stressed, my neck hurts, let me have a drink, which again, in a short quantity may perceive that it relaxes the muscles, and it might do to some extent at the muscular level, but certainly it's not a muscle relaxer. There's definitely more deleterious effects to the body than relaxing the muscles and antioxidants, as we have come to see from the research.
Right, and I think a lot of people, if you've ever had one too many drinks, sometimes you wake up the next morning and you feel like, oh, there's a big crick in my neck or my back kind of hurts. And a lot of times the reason for that is that you may end up in a position because you're so relaxed that you fall asleep in a certain position and don't realize this is not a good position and you stay there, and it actually can end up causing problems, you know, for neck and back pain. Right. So I think it's a double-edged sword there. And I think, again, lower levels are probably as far as you should go.
All right, let's move on. So alcohol and spine, chronic back pain. Josh or Ricky, who's going to?
Yeah, this was me. I mean, this is kind of what we're talking about, though, right? I mean, this is just kind of what we were saying. So, you know, a lot of people actually, unfortunately, use alcohol as a medication. You know, they self-medicate with it, and that's really where the real danger lies with it. Using alcohol to cope with your pain is really not appropriate, and can lead to some other, you know, major issues. You know, so this is a big thing to look out for. That's why, you know, again, low levels, maybe one drink per day at most, is really what you're looking for an anti-inflammatory effect. There are some animal models that have looked at how alcohol can also affect the vasculature, so it can decrease blood flow, which then means that the nerves and the bones and the discs that are in your spine don't get enough oxygen nutrients that they would normally do. So chronic alcohol use may actually affect the spine in a negative way there. And then, as we talked about, the muscle relaxant issue can feel good in the moment, but can then cause more issues down the road.
Now, when you talk about inflammation or anti-inflammatory agents, I'm thinking Mediterranean diet. I know maybe I think we have a slide about that later, but just remind us again, a good Mediterranean diet, and frequently you indulge that with a nice glass of red wine,
right,
or white wine. So you have the benefit of one and the other, but also, you know, why is the Mediterranean diet, why is that considered beneficial?
So that, again, Mediterranean diet it's because those countries around the Mediterranean had a specific diet and do also drink a lot of wine. And they end up having really longer lifespans, healthier lives on average. And so the thought was, you know, why is that, right? So the Mediterranean diet is actually pretty straightforward. It's a lot of fish. So you're getting a lot of omega-3 fatty acids, which are also antioxidants. You're doing leaner meats like chicken. You're doing less red meat on average. When you're doing carbohydrates, it's usually complex carbohydrates. You're doing whole wheat things. You're not doing processed, refined carbohydrates that we typically eat a lot of in non-Mediterranean diets, like the American diet is usually pretty heavy on that. And then probably most importantly, it's a lot of fresh vegetables and fruits. And you get so many good antioxidant properties with those types of food. So a lot of that, you know, that's really what you're looking for. Very low on sugar, very low on processed foods, and really high on the organic, you know, sort of fresh vegetables, fruits, lean meats. And that's really what it's all about. Olive oil as well. It's a healthy, you know, oil compared to some of the oil that you know is used in other areas of the world. So that combined with some of the wine, you know, which I think does add some anti-inflammatory properties, you know, probably goes into that. So the Mediterranean diet is something I actually tell patients about all the time. It's a very good diet to try to follow.
I completely agree. There's a question here that's interesting. What about vitamin supplements? Is there anything other than particular diet or red wine? Anything that you guys recommend in terms of supplements?
The challenge with supplements is the regulation. FDA doesn't have much oversight over supplements. Anyone can kind of bring a supplement to market. By and large, most are safe, and some have been studied for anti-inflammation. In particular, if you go to the next slide, you'll see, resveratrol is one of the chemicals that Dr. Weaver talked about. It's present in wine. But if you think about how much resveratrol you actually need to have that anti-inflammatory benefit, one glass of wine has 2 milligrams. And when the animal studies have been done, mostly with mice, to look at what's the dose to get that anti-inflammatory benefit, you need 1 gram. So that's 500 glasses of wine. Obviously, that's not a reason to drink wine then. That's, if people who drink wine say, I drink it for the anti-inflammatory benefit, that's probably not accurate just because the dose isn't there. Now, resveratrol does come in a supplement where you can take it in a capsule, 500 milligrams. Omega-3 fatty acids that Dr. Weaver talked about, also great for inflammation. Curcumin, turmeric is a spice that we use a lot in Indian food, also been shown to be very effective. The same thing with curcumin. If you use a tablespoon of turmeric, which is the Indian spice, you would need 10 tablespoons to get the effective dose. I mean, you can't cook with 10 tablespoons. Your food would be orange, it'd be all chalky and powdery. But if you take the capsule, that has been shown to be pretty effective with some of the studies. So those are the big 3 supplements that I tell patients: resveratrol, omega-3 fatty acids, and curcumin.
Yep. And I'll just dovetail on that. Curcumin or turmeric and omega-3 fatty acids are usually my top 2 as well. But I would like to point out too that the idea here is I don't think we should be relying heavily on supplements, because I think really I want to think more of food as medicine, because you're right that resveratrol is only a small amount in wine, but wine also has a ton of other compounds, chemical compounds, polyphenols, other things that probably all act together. And I think the best thing you can do is eat a lot of fresh vegetables and fruits, because you're going to get a ton of these antioxidants at play. And there's literally hundreds of them, that are out there.
Right.
So it's kind of like the idea is eat the rainbow. You want to eat all the different colors, because there's all different kinds of antioxidants that go into that. And it really does make a difference, I think. Using food as medicine in that sense is probably going to be better than doing a mega dose of 1 out of hundreds of different, antioxidants.
Sure. Yep.
There's just a comment. Linda says, my mom is 94 and has old bones. She has a back problem or back problems. What is your recommendation for old bones? And since we're talking about supplements, I'm just thinking, vitamin D, calcium, and that then brings us to almost a different topic, osteoporosis, right? I mean, there's a big, and that's obviously an area where nutrition can certainly have a big impact, and especially supplements. And you want to talk, Ricky, you want to talk about that a little bit? Osteoporosis.
The challenge with bone, especially in postmenopausal women, is there's a steep decline in the density of your bones after menopause. And we usually tell patients to supplement that with calcium and vitamin D. Usually calcium, the dose is 800 milligrams or 1200 milligrams, and vitamin D, 400 to 1200 units. Now, if you're having a pretty well-balanced diet, like Dr. Weaver mentioned, you're eating the rainbow, you're eating green leafy vegetables, you're probably going to get a sufficient amount of vitamins and calcium to go into your bones to provide that hardening. But really what we've seen by building the muscles around the bone, by doing resistance training, by walking, by taking the stairs when you can, I mean, that's stress. The body loves stress. It needs stress. And that stress on the bones is actually good at building the density. So, there's other cardiology studies that come out saying, if you take too much calcium, that might have adverse implications on your heart. The jury is still not fully convinced that might be the case. But if we can avoid needing these extra supplements and doing the things that work, food is medicine, mobility is medicine, all these things that have been tried and true for so many years with such little side effect profile, I think we should encourage our patients to start there.
Got it. All right, let's see what we have here as so just to go back, close the loop with the quarantini. Now, let's say, Josh, you talked about the quantities. Obviously, that makes a big difference. But let's say you have the same amount of alcohol in, as a glass of wine versus a shot of vodka. Do we know, is there one better than the other? Do we know anything about that in terms of back neck issues? Or musculoskeletal issues?
Well, the short answer is we don't know. There's not a lot of data on alcohol and spine directly, let alone which types of alcohol, right? So I think we don't really know. There are some studies to suggest that different types of alcohol confer the same, at least earlier on, conferred the same kind of benefit from a heart health perspective. But some of that is now being kind of debunked a little bit. And so I don't think that's all very clear. I think the idea, at least theoretically, is that wine is probably a healthier option because it, has all of those antioxidant properties of the grape that's in them. So I think, in general, in theory, that's probably a healthier way to go. But I think, again, just to reiterate, the really healthy thing is if you're going to do a hard liquor, it really would be one shot a day, and that would be the limit, according to the guidelines.
Yeah.
The other thing to think about is, most of the vodkas, which are prepared from potatoes, are simple carbs, simple starches, and that's not ideal either. So that can certainly raise the inflammation and be not an antioxidant, just like wine.
Right.
That being said, I don't think Dr. Hartl is suggesting we do a head-to-head trial here at the Spine Center.
No, I don't think we'll shoot.
I'll be on the wine arm of that trial.
Well, I think moderation is important, obviously. I think hydration is important. Drinking alcohol can dehydrate you, and that can cause a whole other set of problems with kidneys, dehydration, kidney stones. I mean, there's a host of literature about that. So you got to be really careful. Then obviously you got to pair it with good food, hopefully a good Mediterranean diet, as Dr. Weaver indicated. What about a vegan diet? Ricky, any thoughts about that? Vegan diet versus Mediterranean versus other types of diets?
The Mediterranean diet always gets kind of lauded as the number one diet. U.S. News and World Report always comes out with their rankings. Mediterranean diet's always top. Dash is one of them as well. And I think it's because it's complex. There's nuts, there's legumes, there's whole food, whole vegetables, there's some fish and not so much red meat. Now, vegan diet probably is good for you. If I had the fortitude to become a vegan, I'd probably do it. I would probably miss cheese and a little bit of dairy too much. But we know that cheese and dairy, for the most part, are pro-inflammatory. These are carbs, there are sugars. If you ever look at a glass of milk, there's like 14 grams of sugars in a glass of milk. We think there's protein, which there is vitamin D. But I would say the vegan diet, if you can do it, it's probably going to give you a benefit. I've had patients who have musculoskeletal issues and arthritis have gone vegan, and within 6 to 12 weeks, fully asymptomatic, functioning much better. Again, this is anecdotal. It's not randomized and controlled, but I believe there's tremendous value in going vegan.
I'll just add to that really quick. The vegan diet can be very, very healthy because it's primarily plant-based. And the fact that you're reducing those pro-inflammatory foods, as you mentioned, but you can do an unhealthy vegan diet. There are a lot of processed foods that are out there that are technically vegan that are actually really not good for you. So I've seen a lot of people who are unhealthy vegans, and I've seen a lot of people who are very, very healthy vegans. Doing that diet is actually quite good, but you have to do it correctly. You also have to be careful because there may be a risk of lower B12 levels on a vegan diet. So you have to make sure that you're getting that supplement while you're on the vegan diet. Generally, you get enough protein because there's actually a lot of protein in different kinds of plants. So the concern about if you don't eat meat, are you going to get enough protein? That's actually not accurate if you're doing the vegan diet the proper way.
There's a question here from the audience about lumbar spinal stenosis. And I forgot now who it was, but he or she asked, is there anything in terms of nutrition that helps you with symptoms of lumbar spinal stenosis? And I answered immediately saying, no, there's nothing. But I was just listening to you guys, and I got to take that back because there is something that we can do in terms of nutrition when it comes to lumbar spinal stenosis. And actually, the two of you and myself, we saw a very prominent, everybody here would know him, a patient a few weeks ago who suffered from lumbar spinal stenosis due to epidural lipomatosis, which is basically a collection of fat, body fat that's inside the spinal canal that's causing severe nerve compression and can cause, back pain and leg pain, neurogenic claudication, as we call it. And he went on a diet about 6 months ago and he lost 45 pounds. And we saw him, if you remember, a few weeks ago we saw him back in the office, and we got another MRI scan, and the lumbar stenosis has totally disappeared. But in that particular patient, the lumbar stenosis was due to fat tissue that had accumulated in the spinal canal, which is a rare cause of lumbar spinal stenosis, but which is a great example for a pathology that can actually respond to dieting. You can really treat your lumbar stenosis with an effective diet if your lumbar stenosis is caused by fat tissue. And that's something to consider. If you have lumbar spinal stenosis, ask your doctor or ask us, is it epidural lipomatosis? Because if it is, you can actually treat this very, very successfully by dieting.
Right.
So, all right, let's there are a lot of questions here, but let's talk a little bit more about dieting. And we talked about chronic inflammation, fats, different types of carbs. MSG, what is that? Who put that in here?
Yeah, so MSG is a food that's found in soy sauce and foods. Those tend to be pro-inflammatory. This slide was mostly put up to show what are all the things that we probably eat on a regular basis that are pro-inflammatory. Red meat comes up all the time. These simple sugars like corn, potatoes, dairy, of course, that we mentioned. But even to your example about the spinal stenosis, spinal stenosis is a imaging finding. A lot of patients on this call with us probably have spinal stenosis on imaging, but it's really the inflammation causing symptoms. So if they could bring down systemic inflammation in their body through diet, through exercise, they might notice a significant functional improvement that may not require any of our interventions, no injections, no medications, no surgery. So I think bringing down inflammation is very important for multiple reasons.
Now, Ricky, you mentioned soy sauce. If I hear soy sauce, I think about sushi. And so what about sushi and the health benefits of sushi? I always thought sushi would be very, very healthy, but I think that's not always the case. Is that correct?
What's interesting about sushi, nowadays you go, like we have a Japanese grocery store right here down the street. A lot of the sushi is made with brown rice now because they found that these white rice, the simple carbs, again, are pro-inflammatory. What's nice about sushi is that it is fish. Fish tends to be healthy. Even wasabi can increase your metabolism a little bit.
Really?
So by and large, sushi is probably okay for you. They make Naruto sushi that's got no rice, that's got cucumbers all around it. So I'm sure there's a nice way that's very healthy. From that part of the world, even Okinawa, which is, next to Japan, the inhabitants of that island live longer than anywhere else in the world, probably due to what they eat and their physical activity. So there's probably some truth to it. Again, no level 1 evidence yet to support that, but I would support sushi.
I think the salt, right, is a concern in the soy sauce.
Right.
Salt. Right. All right, let's move on. We have a few more topics to cover. So I think we really talked about nutrition extensively. We talked about vegan diet, Mediterranean diet. There's a connection between the gut and the central nervous system, right? So nutrition can affect your central nervous system, and therefore can also affect the way that you perceive and experience pain, right? Josh, you want to talk about that real quick before we come to Netflix?
Sure. So this is actually a super fascinating area that's really being heavily researched right now. Sort of the gut-brain axis, it's called. So, you've got this microbiome, which is a bunch of the types of bacteria that are living in your GI tract, all the way from your mouth, all the way down through the intestines. And that microbiome culture that exists in us very much interacts with the kinds of food that we eat. And I think, those bacteria can be a mix of good and bad bacteria, and they can give off pro-inflammatory chemicals, and they can give off anti-inflammatory chemicals. There is a link between that microbiome in the gut and the nervous system. And in particular, the vagus nerve, which basically runs from the gut to the brain, can actually, in some way that we don't fully understand yet, but there's a lot of research being done on that, can sort of transmit a lot of those chemical signals up to the brain. And so there is this link between brain and gut. And I think, that we're trying to tap into a little bit to figure out how that works and how we can modulate the microbiome to help reduce inflammation and reduce our perception of pain at a brain level, but through the gut. And I really think there's going to be a lot of really interesting treatments in the future that are going to be, based on that gut-brain axis.
Well, that's fascinating. I think Dr. Weaver clearly is the smartest guy here in the Spine Center. So that's quite remarkable. To listen to you guys. Let's move on. Let's talk a little bit about Netflix. Ricky.
Yeah, so part of this talk was not just about wine and diet. It's about how the quarantine and social distancing and being isolated is affecting the spine. Certainly, we've seen a lot of people present with upper back and neck pain, even increased incidence of lower back pain. And why is that? Most of us were home for a lot of last year, and even if when work did reopen, the workforce was working from home, so they didn't have these ergonomic setups like we do where we are currently. So people are working from their bed or their couch or their coffee table and putting a lot of excess pressures on their spine and their upper back and even their lower back. So if you look at that diagram at the bottom, that person who's sitting at the desk, 185, 275, this is the percentage of increased pressure on your lower back. And even that picture with that gentleman hunched over looking at the laptop, he's not only putting 2 or 3 times X pressure on his lower back, he's also putting the same on his upper neck and upper back by his head being slouched forward and shoulders rounded. So, Netflix and slouch, we sit there, we might have a glass of wine and sit on the couch and have poor posture, but doing this repetitively and cumulatively will certainly have deleterious effects on your spine.
So what's your recommendation if somebody, we're all on Zoom calls all day long now. We see patients by telemedicine, right, as doctors. So we spend a lot of time. Patients sit at home. People may work from home. What's your recommendation? How do you prevent this?
So if you think of your spine, it has bones, and in between the bones, you have these discs. These discs are like sponges. So when you're sitting, you have squeezed out all of the nutrients of the sponge, right? They compress. So how do you bring water into a sponge? You release the pressure. So standing up, decompressing the spine, arching back, changing positions while you're on a Zoom call, sitting, standing, that stuff is good for diffusion. It's good for bringing nutrients and oxygen into the spine. So like Josh said, which I think we should get tattooed on our bodies, mobility is medicine, food is medicine. All these things are really, really beneficial for the spine.
What do you recommend? Do you recommend getting up, walking around, or do you recommend stretching or any type of exercise in between? How often should you do that? And any other recommendations?
For me, anytime you can get a cue to change your position, the better. Like for us, when we do virtual visits, we have a patient every 20, 30 minutes. There's my cue. In between patients, stand up, march in place a little bit, arch back, pull the shoulder blades back, sit back down, back to work. If you're someone who works at home, maybe you stand up during every phone call. That's your cue. Again, as much as you can, 2 to 3 times per hour. Try not to be in a fixed position for more than 30 minutes. That'll probably prevent bad things from happening to the spine.
I got it. Yeah, look at the pressures. I mean, that's quite remarkable, these numbers. And that's why, as a surgeon, what we're worried about is that, you do these activities, you lift. That's why we tell patients after surgery, no lifting, no bending, no twisting for 6 weeks, because especially early after surgery, the spine and the discs are very vulnerable. And if you look at these numbers here, compared to lying flat, where there's virtually no pressure on the discs, but if you have somebody standing up, leaning forward, lifting something, puts a lot of pressure on the disc, and you can have a recurrent, like a disc herniation, or something can break, and you can have a lot of damage within your spine. So really important to keep that in mind. And sometimes we tell patients to wear a brace, just so they avoid leaning forward and bending.
Yep.
So really, really, really good advice here. What else can we do? Ricky?
Yeah, so same, just going back on the things that we have mentioned over and over, maintaining a healthy body weight. We know that weight plays a role on your spine. For every pound of weight extra in your abdomen, your lumbar spine takes on about 7 to 10 pounds. So if you're someone who needs to lose or who could benefit from losing 5 to 10 pounds, your spine's going to be 35 to 50 pounds happier. Staying active, every society, the American College of Sports Medicine, the American Heart Association, American Cancer Society, everyone is recommending 150 minutes a week of exercise. How you break that up is kind of up to you. Some patients say 30 minutes, 5 days a week. But the trick with that exercise number, you can't just be walking casually. You need to exercise at a level where you can't really have a conversation with the person you're with. Maybe 1 or 2 words per sentence, but you're working to get that exercise. And that might be a different pace for everyone, but everyone's individual. But you kind of use that as a barometer of how intense you're exercising. Posture we talked about, sleeping, certainly important. Not getting good quality sleep increases stress in the body. I mentioned that stress is good for you in small doses. Chronic stress, not so great. That does increase inflammation in the body. And then smoking. I hope, the majority of the listeners and the viewers of this webinar are non-smokers, but every study since the beginning of time has shown it affects your spine. It decreases the disc height. You shrink. It decreases bone density. Bad for the blood vessels. So please, please, please try your best not to smoke. Vaping is technically included in that group.
Great comments. And there's a comment here by Colette about Tai Chi, and you were talking about sleeping. We actually have later this evening, we have a Zoom webinar with Yang Yang. I don't know if you remember him. He used to work with us a lot, and we just got in touch with him again, and we're going to do a spine time webinar with him as well in a few weeks. But he's holding a course tonight about using Tai Chi and the Tai Chi exercises to get better sleep at night. And that's actually, I think, at 8 o'clock tonight. So again, something that we're really taking very seriously here in the Center for Comprehensive Spine Care. How do you really take good care of your body, your mind, your back, and your neck? So sleeping well is very important. Quit smoking. A few other things that come to mind when I see smoking here, I think about all the bad habits that my Italian grandparents used, smoking, coffee, and wine, right? What about coffee?
Well, coffee is actually I think coffee is the #1 source of antioxidants in America because we drink so much of it. But coffee and tea, probably even more so than coffee, has a lot of these flavonoids, these anti-inflammatory chemicals that are in them, and they can be really beneficial. There's actually studies that have shown a few cups of coffee a day can reduce your risk of dementia, can reduce your risk of Parkinson's. I do think that there are, these antioxidant properties that are in them that actually do probably reduce inflammation and brain inflammation and degeneration. Probably it will do the same thing to, spine and nerve health as well. So I think those are always really good things to do. And again, moderation is key. A couple of cups of coffee is probably fine. Green tea has what are called catechins that are in them that are a little bit these special kind of polyphenol that has been studied pretty extensively, and I think incorporating that into your diet is very reasonable.
Decaf coffee is a question here. How about that?
Yeah. Decaf coffee will also have the same amount of antioxidants in them, so that's certainly reasonable to do as well.
And coffee and osteoporosis. What do we know about that?
Yeah, there is a link in terms of coffee and an association between osteoporosis and that in terms of leaching out calcium. And I'm not too familiar on the data behind that, but I know there is that association, which again, I think it's why moderation is key. You don't want to overdo it on the coffee.
Right. Okay, so there's so many things potentially to talk about. I find a lot of patients ask me about the mattress. What type of mattress? It's very, very difficult to really give people a good recommendation because there's no research really on this. A few studies out there. Neck pillows, mattresses. What do you guys recommend? Is there any resource available for patients to find out more about this?
Mattresses are tricky. There are a few not well-powered studies, but some suggest that a medium firm or firmer mattress that gives you support tends to be better than one of those old school pillow top mattresses where you sink and your body kind of curves. Those patients tend to wake up a little more stiff. And if you go to any mattress store now, and most are actually online, you rarely find those type of box spring pillow top mattresses. Everything is memory foam with some type of cushion on top to give you that stability. Pillows, same kind of thing. I wouldn't recommend the My Pillow for political reasons, but
What's that?
anything that gives you a little bit of support where your neck is neutral. You know, you don't want pillows where your neck is pushed forward, and you don't want no pillow where your neck is extension. So anything where your neck is neutral will probably be better for you long term.
So what about a roll under your neck? Just a little bit of roll to kind of support the lordosis of your cervical spine.
Yeah, totally. Just, a small towel, that will suffice. Again, anything to give you a little support to make your ear in line with your shoulders. That's probably more than enough. What I tend to tell patients is get a couple really soft down pillows so you can modify how thick it is instead of getting these really thick memory foam pillows, because then you can't adjust.
I think another big reason why there's not a lot of data on this is that people sleep in very different ways too, and that really depends. So if you're a side sleeper, if you sleep on your stomach, if you sleep on your back, you have to change how your alignment is, to get that neutral spine alignment. So I do show people online if you look for like neutral spine alignment, you can see you're really shooting for that alignment that supports it no matter what position you're in. And so I think that that matters in terms of what kind of mattress you get, what kind of pillow you use.
Yeah, so as a comment, I sleep with a wedge and then 3 pillows. That seems like a lot, but then again, I'm thinking of patients who have a deformity already. There's certain patients who have a spinal deformity, and they actually, they're not comfortable in a flat position. They actually need support to kind of accommodate that deformity at night. And those are obviously, exceptions, of course. Okay, it goes on and on. What about massage? Massage.
Massage is a modality that can be helpful. A lot of times you go to physical therapy and they can do manual work on you. You go to a massage therapist and people are doing things to you. That stuff is fine to supplement, but really engaging your own muscles, being active about your rehab program is going to give you the biggest bang for its buck. So doing a little bit of both. If massage feels good, great, but then really take the effort to engage those muscles. Do some resistance training. Good for the muscles, good for the joints, certainly good for the bones, as we know. But a little bit of both would be helpful.
You mean before or after the massage?
I tend to say after. Don't get a massage and then just sit there and do nothing. Use that as an opportunity. You're in a relatively low pain state. Use that time to really do your exercise program.
I got it. Interesting. Josh, any other thoughts about acupuncture?
Oh, I love acupuncture.
I know
I refer people out to acupuncture all the time. There's actually a lot of data on acupuncture, and especially for nerve pain and back pain and neck pain. The data unfortunately is a little conflicted again, but I think it's generally a very low risk, not no risk, but it's a low risk kind of treatment modality. And I think you can get a lot of benefit from it. There does seem to be some chemical changes that go on. It seems to stimulate the nervous system and the lymphatic system in ways that we're not fully, understanding of at this point. But I do think if you do 8 to 12 sessions for pain reasons, you may find a reduction in pain. And I'm all for it. I think the trick is just finding a licensed and competent acupuncturist who you can trust.
But we have those here. I mean, we're affiliated with a number of really good acupuncturists, and same is true with, somebody asked about chiropractors. There's some chiropractors out there that are really excellent, and we work. I know my practice, and I know you guys also. We have the names and the contacts of some really good chiropractors. Why should somebody see a chiropractor versus a physical therapist or versus another specialist?
I don't think there's a right answer of one versus the other. I think they all have value add to a patient's functional outcome. We tend to use McKinsey certified physical therapists who have a doctorate in therapy, who can kind of work with us to figure out the entire rehabilitation program. Chiropractic care definitely has benefit. The manual work that they can do, they do a lot of active release therapy as well. So we certainly see role in chiropractic care for certain conditions. With cervical spine, we tend to be a little more cautious, of course, but with lumbar, sacroiliac joint. And then acupuncture is kind of a holistic approach. It's bringing down inflammation. It's working through either the meridians on the eastern side or with alignment on the western. And like Josh said, it's a very, very low risk proposition and could be very high yield.
I think that's all very, very valuable and really fascinating information. I want to thank both of you. And what I've really learned over the last 45 minutes, and I think we should come to an end now to be respectful of everybody's time. But what I've learned is really there's so much to spine care and neck care that's way beyond what we do on a daily basis, certainly in the operating room or even in the spine center here. So I think for patients, the message is that you can really take responsibility. You can be in charge of a lot of what's going on with your spine health. And that starts, not only with exercises, but also with nutrition. We talked about wine in moderation. Obviously, you got to take that into consideration. Nutrition, Mediterranean diet, vegan diet. We talked about how you sleep at night, the types of exercise that you do, how you structure your work environment, how you mix up different types of exercises. We talked about massage, acupuncture. We could fill books with these topics, of course. But the important thing, certainly what I take out of this, is that you can really be in charge and you can really have a huge impact on your spine health, even if you have a back problem that may require some type of intervention. There's so much that you can do before and after and during that's really where you're in control. And I think that's very important for patients to understand that they can be in charge and they can be in control by, kind of manipulating those little aspects of your daily life. Maybe a very last question. There's so much information. Do you personally use any particular book or is there any kind of resource, a website, or where do patients go to if they have questions about these more, everyday topics related to spine care?
I think that's a great question. I think that's a tremendous opportunity for us in our comprehensive spine care to create a database of these common questions that people ask and have the resources plugged in. Yeah, but you're right. There's a lot of misinformation out there. Dr. Google doesn't know everything. But I love that question. I think you have made us a call to action to collaborate and collate this for you guys.
Yeah, I think what I would say for now is, be careful what you read online, and ask your doctors. I mean, there are a lot of doctors out there who do know at least enough about these areas to guide you in the right direction. But I totally agree. I think we're going to have to start a book here.
Unfortunately, we'll need another pandemic to sit at home for 3 months to have the time to put all this together, and we don't want that. But Ricky and Josh, it's always a pleasure, and great having you, and Roseanne and the others from the neurosurgical group. Thanks for putting this together. And of course, big thanks to you at home and for supporting this and for always being so supportive, and great to have you. See you again in 2 weeks. We have a lot of exciting topics coming up. Yang is going to talk about Tai Chi at some point, and just stay on top of the website, and we'll let you know what's coming up next. Thank you so much, and have a good night.
Thank you, everyone.